Hey y'all, so I'm on my way to work. It is Wednesday. We had a short week this week because of Labor Day. So yeah, welcome to a day in my life as an internal medicine medical assistant now. I don't work in OBGYN anymore. I work in internal medicine. So the way that we do things at my new office is a little bit different, but hopefully I can show you guys some cool things today. So let's get into our week. Okay, y'all, this is one of the rooms that we use for our patients. So I'm just showing you guys the room. The chair is over there, and I'm showing you guys back to the blood pressure machine that we use for manual blood pressure sometimes. Hey guys, I don't know if you guys can tell, but I'm in my car because I'm currently eating lunch because I'm on my lunch break. But yeah, hopefully I get to show you guys like more of like what I do day to day. Also, I want to talk to you guys about like what internal medicine is. So like basically internal medicine is like basically the providers see everybody, right? So they see men, women mostly, younger and older adults. We see a lot of older adults though at the office that I work at, mostly not that many younger people. Hey y'all, so it's me again, just showing you guys my scrubs for the day. I'm wearing gray. I'm going to wear gray or black scrubs in my office, but that's my stethoscope. I always have my stethoscope on me now at this office because I never know when I might need to do manual blood pressure, and I need my stethoscope to do that. So yeah, I'm just showing you guys, my scrub outfit, very cute. I'm liking the gray and the pink together. I think that the stethoscope accents the gray scrubs really well. So yeah, it was just me basically saying hi. I want to give you guys information on my scrubs. Yeah, so my scrubs are actually from Healing Hands. I don't know if you guys have heard of them, but I highly recommend their scrubs because they're really comfortable. And in this clip, I was showing you guys how I keep my stethoscope in my pocket because my scrubs have like 4 pockets, 2 on the shirt and 2 on the pants. But like I said, like these scrubs are really, really comfortable. Healing Hands, I think they have a lot more colors other than the gray and black ones, I'm pretty sure. But like I said, in my office, we're only allowed to wear gray and black, and I was just showing you here like the length. They aren't too long, which is good for me because I'm short. Like I only my height is only like 5'1", I think, or 5'2", so I'm really petite. And I got the scrubs in petite because I already know that scrubs are really long on me sometimes if they're regular. And so in this clip, I'm showing you guys an up-close personal view of the blood pressure machine that we use for manual blood pressure because sometimes, the other MAs are using the other blood pressure machine, the automatic one. So sometimes we do have to do manual blood pressure. And in this clip, I'm showing you guys the swab. So if you guys have seen my other medical assistant day in my life videos, when I worked at an OBGYN's office, you guys are familiar with those swabs that we use for cultures for our patients. And I was just showing you guys the cabinet. The gloves are up there. And then I'm showing you guys, the alcohol pads that we use to wipe off, the vials before we do vaccine. Hey y'all, so I'm back now from work, and I just want to talk to you guys about a couple of things. So I do work for an internal medicine doctor. So in my previous clip, I talked to you guys about how we don't see any kids because it's internal medicine. So internal medicine only deals with adults, but if she was like a family medicine physician, then she would see children. So family medicine physicians usually see children and adults, and internal medicine only see adults. Also, because we see all adults, it means we see males and females. Sometimes the doctor does do PAPs or cultures and swabs on our patients that come in for our women patients, so if they request or if they need to have that done. So in that case, usually for the PAPs, I would be in there with her, assisting her while she conducts the PAPs, which every office is different. Like, not all internal medicine doctors, first of all, do PAPs, but also the ones that do, not all of them want their MAs or need their MAs to be in the room with them while they do their PAPs. This is something that's different for me personally from when I worked in OBGYN, because when I worked in my OBGYN's office, I wouldn't assist in pap smears. The physician would do it herself. I would just help set up for the pap smears, and then the physician would go in and do her thing. But in this office, it's a little bit different. I do have to help and assist the doctor with pap. Also, the setup is pretty similar. Except we have a tray that we use for pap smears or cultures, and we just put the the pipettes out, we put the swabs out, we put the swab cultures out, and the paps out as well. And we leave everything closed for the physician. And then at this office, we also use plastic speculums, and we have the ones that require the light. So I can show you guys that maybe tomorrow, the light that I'm talking about that goes in the actual speculum, so that it's easier for her to see the patient, see inside the patient and everything. But I definitely would say it's definitely a lot different than working OBGYN, because OBGYN is more specific, so we only saw women we only saw women, and then we see pregnant patients. So it's very tailored and specific to that group of people. But when you work in internal medicine, it's a lot more broad, and you see different, different health problems that you might not see when you work in OBGYN. So I really think it's a great experience for me before I, go off to PA school and all of that jazz. So yeah, if you guys have any questions about working in internal medicine and being an internal medicine MA, please don't hesitate to reach out to me. Or if you have any questions about working as an OBGYN MA, also don't hesitate to reach out to me too, because I worked in both fields, so I can give you guys information on both fields as well. And then the office I work at, MAs also have to do PPD tests. So if you don't know what a PPD test is, basically a test to see if someone has tuberculosis. Usually it's used for work, so people who are about to get employed in certain healthcare settings, or if they're getting employed at a hospital or at a clinic, usually they'll ask for their employees to get a TB test to make sure it comes back all clear before they can work. So usually that's what we see. Or sometimes we have vaccines, maybe someone needs to get a pneumonia vaccine, or maybe a vitamin vaccine. I don't really think that my doctor specifically does vitamin vaccines, but I know she probably does do pneumonia vaccines, because a lot of the patients that we see are older. So there's also that. So yeah, so a lot of our patients are older, versus when I worked in OBGYN, a lot of our patients were middle age, so some of them were younger. But I do think at this office I see more older patients than working at OBGYN. But yeah, overall I do think it's a good experience. It's definitely a lot different than when I worked in OBGYN though, because like I said, working in OBGYN is more specific, and working in internal medicine isn't as specific as working in internal medicine.